Every few years, our department or administration hands everyone a list of career interests and pathways, and you're supposed to just check which interest you and what your strengths are. And I didn't find that any of these options were what I felt I was good at. And so I made my own box and I drew a little square and I checked it off, and right next to it I wrote nurse innovator, and because that's what I wanted to pursue and that's what I felt the direction of nursing was headed, and I wanted to be a part of it, and I wanted to be a part of it in my unit and push it forward. During your nursing career, especially at bedside, you're hit with those moments that are like, how could this be better? Why do we always do it that way? It doesn't make sense. And those are honestly the catalysts for change. If you've had those moments, it's a great opportunity to really dissect it and figure out if it's an issue with practice, is it an issue with product. I had a patient who went down and was intubated, and I thought I lost the tube, and I had a respiratory therapist with me, and it wasn't until I was in the MRI room with her to this patient, my heart rate was falling on my patient, my saturation was falling, and we didn't know if we had that ET tube in, and we had no supplies to go ahead and figure out a solution to go ahead and help this patient. And so I figured that needs to change. So then I went back and I created a whole internal transport kit. So it comes with all the resources that you're gonna need to go ahead and address that problem if something should happen. And it's just projects like that that I've been able to go ahead and initiate and see through in our department and then interdepartment. So that's been kind of fun. As nurses, we're capable. We're in prime position to solve these problems, not just notice them. And I think it's an opportunity with this Johnson & Johnson Nursing Fellowship to really push innovation and leadership to empower the nurses that are currently at bedside, that when they ask those questions, they have the power to do something about it. My name is Jennifferre Mancillas, and I'm a nurse at Valley Children's Hospital in Madera, California, and I'm super excited to be a part of this Johnson & Johnson Nurse Innovation Fellowship.